Regarding the tube method, how to use tube method in order to determine blood group. We have two parts: forward typing, blood typing, and reverse blood typing or blood grouping. What do you mean by forward, and what's the difference between forward and reverse? Forward, just like the slide method, but you have to do this inside the tube. Which one is reagent and which one is from the patient? Regarding the forward, here the blood is coming from the patient, and the antibody is anti-sera, just as a reagent. As we said previously, we have three different anti-sera: anti-A, anti-B, and anti-RH. So you have to use these antibody as a reagent. Regarding the reverse blood typing, plasma, it means from the patient, and you'll test antibody, presence of antibody in the sample. But here you'll test antigen, presence of antigen on the surface of the red blood cell of the patient. If you want to determine antibody in the sample of the patient, you should have the red blood cell as a reagent. And normally, regarding ABO blood grouping system, we have two types of antibodies: anti-A and anti-B. That's why you have to prepare two different types of red blood cell: a red blood cell with antigen A, a red blood cell from another person with antigen B. And here, as we said, we have to prepare anti-A, anti-B, and anti-RH. That's the difference between forward and reverse blood typing. As we said, we have to prepare a plasma from the patient, or we can use C. Forward typing, we said about preparation of red blood cell suspension, and we said about the preparation of the serum and plasma. So how to perform the test, how to determine the blood group. Forward typing, just like the slide method. We have three different test tubes here, and you have to label them A, B, and D. And we have three reagents, just like the slide method: anti-A, anti-B, and anti-D. Add 1 drop anti-A, 1 drop anti-B, 1 drop anti-D to the corresponding test tubes. What about the sample of the patient? We have to dilute your sample. You have to prepare 5% red blood cell suspension. So you are not going to use the red blood cell directly from the patient. In the test tube, you have to prepare red blood cell suspension. This one is from the patient after doing washing and red blood cell suspension preparation. So you have to transfer 1 drop to each, just like the blood from the sample of the patient. And after mixing, you have to centrifuge them for about 1 minute and check agglutination. Okay, just like that. We have another picture here: patient red blood cell, washed red blood cell 5%, red blood cell suspension, anti-A, anti-B with the red blood cell suspension, and anti-D, and you'll check the result. For example, if you see the clumping here and clumping here, so it means you have the A positive. Okay, that's forward typing. What about reverse typing? In reverse typing, as we said, you are looking for antibodies. That's why you are going to use plasma of the patient. So if you want to detect antibodies, you have to use plasma, and you have to use a red blood cell as a suspension. That's why we have this here: a red blood cell suspension. You can see it here: A1 cell and B cell. So they have cell suspension, red blood cell suspension. Here means we have a red blood cell and we have antigen B on the surface of the red blood cell. And here we have a red blood cell and we have antigen A on the surface of the red blood cell. In this plasma, in this part that you are going to add to the A1, you look for anti-A. And here in this one, you look for anti-B. So if you have anti-B in the plasma, and here we have antigen B, it will bind to antigen B and you'll get a result. But if you don't have anti-B, there is no clumping here. If you have only anti-A will bind to this one and you'll see agglutination here. There is no agglutination here. So you'll have only anti-E in the plasma of the patient. Same here. So B cell and A1 cell as a reagent should be prepared as a red blood cell suspension, and you have to add the plasma of the patient. Be careful, you have to add 2 drops of plasma and 1 drop of the red blood cell suspension. Mixing, centrifugation for 1 minute, and examine agglutination. Look at the results here. No agglutination in both of them. It means you don't have anti-A and anti-B. That's why you have a blood group AB. Only anti-A, it means you have blood group B. Only anti-B, blood group A. Anti-A and anti-B, blood group O. So if you perform both of them together, you'll get a good result. So how to perform both of them, forward and reverse typing, by doing one test. Forward and reverse typing by using gel card. Okay, that's a gel card, and in this gel card we have microtubes. 1, 2, 3, 4, 5, 6 microtubes. A1, B1. It means from the previous slide we have A1 cell and B1 cell. So in the as a reagent here, if you want to detect, we have red blood cell here, nothing, and this one we have antibody, anti-D, and this one BA, it means anti-A and anti-B. Okay, as a reagent we have this, and we have antigen A and antigen B. So in the sample of the patient, we are looking for, as a sample, here we will look for an antigen A, red blood cell with antigen A, and red blood cell with antigen, let's just say B, and here a red blood cell with antigen D. Okay, because you have anti-A, anti-B, and this one here, that's a control, and these two we will look for anti-A, and in this one for anti-B. So you look for these types of antibodies. In order to detect anti-A and anti-B, you have to add plasma to these 2 test tubes. And in order to detect antigens on the surface of the red blood cell with the control, you have to add red blood cell suspension of the patient. Okay. After addition of these different parts, red blood cell of the patient to these 4, plasma of the patient to these 2, and we have a reagent here as a red blood cell A, red blood cell with antigen B as a reagent, and we have anti-A, anti-B, anti-D. Now this one is control. Okay, we have to add the red blood cell of the patient only. After addition, you have incubation for about 10 minutes at room temperature and centrifugation for 10 minutes. Be careful, you have to use a specific type of centrifuge for these gel cards. How to read the result? As we said, we have gel here. Inside the microtubes, you have gel from the top. Okay? The gel will permit single and individual red blood cells to precipitate, while if you have clotted red blood cell, they will remain from the top. These red parts remaining on the top means we have clumping or agglutination. Here we have clumping, it means we have antigen A on the surface of the red blood cell of this patient. We don't have antigen B, we have antigen D. So we have antigens A and D here. What about this one? We don't have anti A here, but we have anti B. The blood group of this person is A plus. And normally in A plus we have anti-B in the plasma, as we said here. If you read this result, same. We have agglutination here, no agglutination, agglutination. Agglutination means we have anti-D, so you have antigen D, antigen A positive, and also we have anti-B in the plasma.